Public health, in its most basic sense, aims to provide conditions in which people can be healthy. This refers to all organized measures, whether public or private, to prevent disease, promote health, and prolong life among the population as a whole. Though they are not perhaps immediately identifiable, public health interventions are in place all around us. From health promotion to health policies, public health affects nearly everything we do. The public health system is comprised of various agencies and organizations, including schools, civic groups, and faith institutions. There are three core functions that every public health institution strives to meet. They are assessment, policy development, and assurance. Assessment involves monitoring the health of populations as well as diagnosing and investigating potential health threats. Policy development is centered around developing policies, mobilizing community partnerships, and educating that community. Assurance comprises the duties of enforcing laws, providing care, assuring a competent public health workforce, and evaluating services. Together with research, the services that fall under the three core functions of public health make up the 10 essential public health services. Public health interventions that can be seen at UNH include chronic disease prevention, sexual assault prevention, sexual health promotion, and measures aimed at protecting against the harmful effects of tobacco.
Public health has a long history. One of the first preventative medicine efforts dates back to 1796. Dr. Edward Jenner tested his first vaccine on an 8-year-old boy. He followed an old wives' tale about how milkmaids, being exposed to the diseased cows, never seemed to contract cowpox. By extracting fluid from a cowpox vesicle and then placing it in a cut in the boy's arm, he hoped to build his immunity to the disease. Although he faced much ridicule for this experiment, the results were successful. This, in turn, was the first vaccine. Soon after this, John Snow became the father of epidemiology, the science of public health. He was an English doctor who sought out a point source for cholera in London. He hypothesized earlier in his career that cholera could be a waterborne illness. He conducted a cohort study and compared the mortality rates of two towns who used water from different places. Using a spot map to show cases of cholera, his findings brought him to the Broad Street pump. After his request of its removal, the outbreak ceased. Efforts such as these in the past contributed to the public health achievements of the 20th century. Among these are immunizations, motor vehicle safety, workplace safety, the control of infectious diseases, declines in deaths from heart disease and stroke, safer and healthier foods, healthier mothers and babies, family planning, fluoridation of drinking water, and tobacco as a health hazard. Public health has come a long way since its early days, and its effects can be seen in actions even in campuses such as UNH.
Many chronic diseases are the direct result of poor diet and inactivity. UNH is taking active steps to prevent the development of such conditions by providing healthy options at dining halls, giving faculty, students, and staff access to fitness and nutrition services, and putting on educational campaigns about the benefits of having a healthy lifestyle. The university also partners with Healthy UNH, an organization whose goal is to make the University of New Hampshire the healthiest college in the nation by the year 2020. The public health interventions promoted on campus have proven successful, and UNH is on its way toward meeting its health goals. I spoke with Kelsey McDonald, the Vice President of the Student Nutrition Association, about the value of nutrition and exercise.
What is the mission of the Student Nutrition Association?
So our mission and goals is to spread nutritional awareness through education, outreach programs in the campus, local, and state communities.
And what is the importance of eating well as it relates to disease prevention and improving health?
So overall diet and diet composition is very important for long-term health in terms of chronic disease risk, weight control, as well as not just physical health but mental and spiritual health, because they all play a role in each other. Because if you aren't well in one of those categories, it'll affect the other. And some of the effects from your actions today you may not see until years down the road, but you want to prevent as many of those as you can through overall diet, with a nutritional, colorful plate, as well as exercise on a daily basis.
Okay.
SHARP is a University of New Hampshire program overseen by Student Life, dedicated to providing free and confidential services to survivors of sexual assault, relationship abuse, sexual harassment, childhood sexual abuse, and stalking, as well as their allies. They also provide education, outreach, and training on the above topics, along with consent, active bystanders, and healthy relationships to the greater New Hampshire community. SHARP's direct services include a 24-hour crisis hotline, emergency medical accompaniment, criminal justice advocacy and information. Their outreach programs provide awareness and educational program for students in residential halls, classrooms, and Greek life. April is actually Sexual Assault Awareness Month. In April of 2001, the U.S. began to nationally observe the month of April as Sexual Assault Awareness Month. Throughout the month, organizations across the country host events and programs to aim to educate the public and reach out to survivors. SHARP also does this throughout campus during the month.
In order to keep the spread of STDs at a minimum here at the University of New Hampshire, programs as well as health seminars have been created in order to educate students and faculty on how to reduce outbreaks on campus. With STDs becoming a growing public health problem, we are lucky to have a director of health promotion such as Kathleen Grace Bishop to make these things possible.
What is being done to prevent the spread of STDs?
Well, we do a lot of education on campus about STIs, STDs, and prevention pieces. And our prevention pieces are about sort of making condom availability, of course, but also skill building around how to use a condom appropriately, how to have conversations with partners about condom use as well.
Are there any other programs other than the free testing?
We do, in addition to the education, active education that we do around STIs and screening and prevention and condom use and talking to partners actively, we also do social media campaigns as well connected to it.
Okay.
And passive education, whether that's articles and magazines or other pieces.
Do students come in and get tested for April more than any other month because of the gift card giveaway? And or is it successful, would you say?
Yes, we have been doing it for several years, and we do see a spike in the number of students who come in the door during the month of April. And we do believe the campaign is part of that reason, which is why we continue it every year. We see it as a wonderful opportunity to get students in the door for screening. It allows an opportunity for education as well as testing.
And over the years, have you found that there is an increase or decrease in the use of protection on campus?
We have an increase in the use of protection based on our information that we gather from the National College Health Assessment that we do every 2 years. But it's still not good enough for us because really what we see is of students who are sexually active, the range in terms of, I'll focus right now on vaginal sex, so I could speak to anal or oral sex, is we're a little bit over 40% utilization of condoms on a regular basis. So we know we want to increase that utilization. And the numbers are much lower for anal or oral sex, so we also want to increase those as well.
Health Services is always trying to promote healthy lifestyle choices to set healthy habits that we will have for the rest of our lives. When it comes to smoking, UNH has started down the path for a smoke-free campus. Right now, there's a 20-foot rule, meaning that you are not permitted to smoke within 20 feet of a door to a building. This impacts UNH because it limits the amount of smoke that could flow into a building. There can be no smoking in courtyards where buildings may block airflow or in stadiums. This helps provide cleaner air inside and outside buildings and less secondhand smoke exposure. It also may reduce the amount of smoking by individuals since they have to walk further away from the building to smoke. And in the winter, when it gets cold, people are less willing to walk 20 feet away from the building. This may not be the most effective rule that UNH has because there isn't anyone around to enforce it. When looking in the UNH smoking and tobacco use pamphlet, it says, all members of the UNH community and its visitors are asked to observe this policy. This statement tells us that we should follow this policy, not that we have to. People still smoke right outside the doors to buildings and don't think twice about it. It is a practical intervention because most people will follow this rule. What UNH really needs to do, and what thousands of other campuses around the nation have been doing, is implementing a smoke-free campus. According to Americans for Non-Smokers' Rights, 1,483 universities are smoke-free as of April 4th, 2016. This has been in the works for several years, but it is time to finally make it official. This is the best way to reduce smoking among UNH students. It will force some people to quit smoking and limit the secondhand exposure. It will also keep our campus cleaner because there won't be any cigarette butts all over the streets and sidewalks. 9 out of 10 UNH students already don't smoke. Let's aim to make that 10 out of 10.